can you just run through osteoarthritis and the path these cases?
Sure. So I think the biggest thing that we need to remember is that osteoarthritis is not just for old dogs, and it happens at any age with acute trauma, genetic predispositions. There's a whole bunch of reasons why osteoarthritis can happen, and it particularly affects the articular cartilage of the joints. And one of the things that we didn't really realize until we started really deep diving into osteoarthritis is the level of pain that these dogs experience, not only in the articular cartilage itself and in the joint complex, if we can call it that, but there are changes in the synovial fluid, which is the lubricating fluid that actually runs through the joints. And also there's a huge amount of compensations on what we call a functional level. So if you fall on your knee, you get a massive soft tissue swelling, your quad gets really tight, so your upper leg muscle gets sore, you start limping, then your hip gets sore, then your other shoulder gets sore, and all of these compensations start to happen. But it's always a knock-on effect, and so often we get obsessed with the joint that we think is affected and we forget about all the other compensations. And that's a really, really big mistake, because not only in the joint complex itself is there neurological changes and hypersensitivity of the nerves that occurs, the knock-on effect that those overstimulated nerves have is that it runs throughout that entire nervous system. And the nervous system runs from the peripheral nerves, so the little kind of branches of nerves, all the way back to the spinal nerves and the spinal cord, all the way to the brain, which means that the body is always compensating for that painful response almost 24/7.